If necessary, adjust the relation by turning the registration screw. One full turn results in a vertical adjustment of 1 millimeter in the anterior region. After adjusting the height, check the distance between the dorsal ends of the two impression trays. The trays or excess material must not come into contact with each other. The movements of the mandible should not be impaired. Now instruct the patient to carry out the following movements. Protrusive movement. Move the mandible forwards and back again. Lateral movement. Move the mandible to the left and back again. Lateral movement. Move the mandible to the right and back again. Remove the registration from the oral cavity and check it for accuracy. To carry out the final check and to secure the registration, place the securing lamina on the registration with one of the openings located above the needlepoint centric tracing. Perform a visual check in the oral cavity by means of repeated closing movements to make sure that the registration pin slides into the corresponding opening of the securing lamina. Confirm the position by having the patient repeat the closing movement several times. Next, make a record of the registration with fast setting plaster. During this procedure, the registration pin has to be located inside the opening of the securing lamina in the mandible. Only the lips are slightly apart. Make sure that the UTS connection remains clean during this procedure. Carefully remove the entire registration from the oral cavity. The UTS and the registration are sent to the dental laboratory. The registration joint holder can be used as an alternative. In this way, the UTS does not have to be transported to the dental laboratory. Try-in. Check the wax dentures according to the aesthetic cosmetic, static, functional and occlusal principles. When trying in the wax dentures, the closing position must result in optimum intercuspation. No major adjustments should be carried out after the try-in. The dentures are returned to the dental laboratory for completion. The completed dentures are incorporated. The final check of the bilateral balanced group guidance, the aesthetic appearance, statics, functions and phonetics shows that the dentures are fully functional.